Welcome to Phoenix Rising with Dr. Z. This podcast is all about conversations about healing and rising from the ashes of your grief and trauma. I'm your host, Dr. Christina Zampitella. It is my sincere hope that this podcast is going to give you the words and the understanding to help you heal through your grief and trauma.
Did you freak out at all, though? I mean, so I hear validation, Claire, because I know when I used to do psych evals for people, to see if they had learning disabilities or ADHD, when they would get the results back, they'd be like, "Thank you so much. Now I understand what's going on." But then there's also the now what?
Right.
Yeah. Right. So, but some people had different experiences with that. But you're calm, cool, collected here. You're like, I knew that. Thank you for finally validating it. And
now what do we do?
I don't think this is everybody's experience, by the way. I think some people
But I think there was a lot of build up to that, right? So there was a lot of, as I was going through my own research and connecting pieces, and my poor husband, I mean, I love him, he's so patient, because I would say, hey, I'm reading this, does this sound like what I've described to you? Or because I did want to get an outside opinion, but of someone who understood and was seeing what was happening, and I would ask him, like, do you think I'm on the right track, or does this seem like I'm reaching,
Mm-hmm.
And he was like, the MS seems like the right track, so we had kind of gone through our own process. So it's not that it wasn't a big deal. It was a huge deal. And I did so much lead up to that on my own that by the time she said, yes, you have MS, I was ready for a treatment, because I'm like, okay, the earlier you detect this, the earlier I get treatment, the better the outcome. So like, where's my meds? Like, what are we doing,
Right.
And so we decided to go. So there's different tiers of medication. I 100% was not giving myself a shot. I said, absolutely not. I will not be doing that. So she said, okay, well, that's fair. I'm like, can I please get an infusion? And she said, no, you cannot, because those are only every 6 months. And I'm like, I would love to just do that and not think about it. And she said, no, because insurance won't pay for it. You have to, that's not a first tier medication they'll approve.
Oh my God. Ugh.
And her preference was to go aggressive early. She's like, when I catch we catch it early like this, I prefer to be aggressive from the beginning, because that's, the best outcomes that we've seen, but insurance won't prove it until you fail a medication. Yeah. So I was really disappointed.
God, insurance fails so many people. And this is just another example of them failing people, where things could have been maybe caught earlier or treated earlier or more aggressively. And they've got the rules and you can't do anything about it. I mean, you can fight it. You can have your doctor fight it all you want. That does not mean anything, right? So I'm so sorry that happened. God.
Can you imagine, though, like fighting with the insurance company? I'm a seemingly healthy, besides my MS, 30-year-old who can run. I got no physical limitations. I'm like getting my doctorate, like, okay.
Yeah.
Like, what's your leg to stand on to even fight that? I've got minimum markers, so we end up doing them.
But that's the thing, though. Sorry, I don't mean to interrupt you again.
Yes, but that's it.
We are so reactive in our medical care. We're not preventative. If they would, it's so stupid, because in the long run, it costs them more money.
Yeah, but they hope you die before that happens.
I knew you were going to say that. I knew you were going to say that.
I've had so many friends with different things happen where I literally had a friend a couple of years ago. She died of cancer, and it was a very, very aggressive cancer. And I knew from the beginning, like, this isn't awesome outlook. So like, this is what it is. And I remember looking at my husband at one point, because there was treatment they wouldn't approve or something. And I was like, oh, they're like hoping she'll die before she gets to.
It's true.
Like, that's what's happening. And then she did. And I was like, oh, well.
Freaking disgusting.
Yeah. So I was not, I'm not, I obviously don't agree with it. But I also am not a millionaire and couldn't just pay for it out of pocket. So I ended up getting on a DMT, so a disease modifying treatment, which is what is recommended for MS. And it used to be, before DMTs, within 10 years of diagnosis, that you would have severe disability, physical, likely cognitive, things like that. I think the main thing was you would use a wheelchair. as your predominant way of getting around. After DMTs, that's not the case. So DMTs have like changed the course of people living with MS. And so I was like, sign me up. What's the best one? And so she prescribed Gilenya. And at the time there wasn't a generic, there is now. And so Gilenya was a pill I took every day. And yes, I asked my doctor how it works. So do you want me to tell you how it works?
You got to make it for those of us who are not like, cognitive, neurocognitive.
No. I'll make it easy. So the way that disease modifying therapies work is they target the cells in our body that are in charge of fighting viruses and illnesses and things like that, right? Part of our immune system. That's why folks who have during COVID, when it was like immune compromised, you're not compromised in your immune system because you have the diagnosis. You're compromised because of the medication, because the medication suppresses your immune system.
Right.
Right. So
that's what the medication I'm still on for my leukemia. That's right. Because I had a infusion day before yesterday, and all my numbers are looking really great. And one of them is neutrophils, which is like a whole thing, whatever. And they're in like a very much of a normal range, but they give me a medication to keep it suppressed.
Right.
And they're actually too high, even though they're absolutely where you would want them to be if you were, not battling. And I said, why are you giving me medication to make me not have as many neutrophils? Right. And they were like, because A, it makes your body work, and B, like harder. And B, we're able to see if you decline faster. Because if you're at 2000, as opposed to, and then you go down to, 1200, then we're not necessarily, worried about that. But if you're at 1500 and you're going down that much, now we know that you're going down below the threshold. So it actually suppresses your body, which, by the way, makes you feel like crap. But you're like, yep. Got it. Got it. And so there is this medication, and what you're talking about is the suppression of it, and you don't even realize it. Like, nobody tells you how it works. You just take the medication, and you're like, "Hey, it's gonna be great." Yeah. So that's what they gave you.
Yes, and so I was on that, and for me, they suppressed my lymphocytes.
Right. Okay.
So over time I would get blood work, and they would say, oh, your blood work looks great. And I would look at it and they're like, my lymphocytes are low. What do you mean it looks great? And so finally I asked one of my doctors, I said, why does my blood work look great if my lymphocytes are low?
Exactly same conversation. Okay.
Right? And he said, oh, because what that means is that your lymphocytes are staying in your lymph nodes and they're not in your bloodstream as available to attack your myelin. So it means that the medication is working. That's how we know the medication is working.
So it's keeping the body from turning on itself.
Yes.
From eating up basically the fat that is in on the neurons of your brain, because that's the myelin sheath is the part that goes down the dendrite, correct?
Yes.
Yeah. So it's the part of, you have the big cell body. The big round thing that most people consider, like when they think of a cell, they think of that. Right. But in the brain, there's this long part of it, and then it goes off and it shoots off and it looks like a little tree, and it
goes along the axons.
It goes on like the axons down to the dendrites, right?
Yeah. And so what happens is it eats away at that. Your cells start to eat away at that material. And so if you think about like an electrical cord, right? Yep. Then it's like exposed wiring,
right?
And
it just doesn't go. It just goes.
It doesn't go where it's supposed to. It's not as efficient. That kind of stuff. And so that's whenever there's findings on my, my brain MRIs, it means there's disease activity has increased to the point where now there's damage they can see.
So it's brain damage, basically, is what's happening. Okay.
Yes.
So they give you the medication. Now, at this point, are you freaking out yet? Like, at what point do you freak out during any of this? Am I the only one that would be dealing with anxiety? I do deal with anxiety. So, you're just
listen. Okay, I will say, I never freaked out, but here's why I didn't freak out. A lot of it is because of the training that I got in my grad school program. So. In my grad school program, every program has the multicultural stuff, right? So we learn about race, ethnicity, sexuality, all this stuff, how that impacts treatment. our program emphasized disability. So disability medical conditions weren't as scary to me because I understood, oh, here are the things that you can do. There's adaptive equipment, there's programming. I understood that there was accessible resources.
But if somebody who did not, like, let's say
yes, I would have
listener or viewer right now, like was looking at this, did not have that background, did not have that training, obviously the exposure, the little bit of reassurance in some ways of like, this isn't going to be necessarily the end all. Like, if you didn't, wouldn't that be terrifying? Yeah.
Absolutely. It would be terrifying because there'd be so much unknown.
And so much like medical jargon, like that people just, who the hell knows that stuff? Like, okay, you and I are sitting here talking about exons and dendrites and blah, who the hell, nobody, you know what I mean? There's like a substrate of people in, you know, because that's their line of work or whatever. So I can imagine that for some of us who are maybe not trained in all of that, just like, what does this mean? I've got a family, I've got children, I've got a job, I've got a career, I've got hobbies and friends and future plans. And my body's now not working the way that it was. And whether I was an athlete or not, like I'm not able to go out and garden anymore, or I can't play the guitar, and like all the things that nobody's really explaining to you in a language that you understand. And then they end up getting frustrated because they shit at empathy in a lot of cases, not everybody, but I mean, medical are not known for being the warmest, fuzziest people.
Right.
And in other times you get the most amazing, most empathetic people at the same time, because thank God. But I imagine many of us, and I include myself because I do have I have epilepsy. That's a chronic illness.
Right.
And I know I have had the extreme of being able to have people who just basically just were like, you got a lower seizure threshold, to the doctor I have now who's like, no, this is what happens. This is how it happens. I can see it's really, and she will stay on my call or whatever. I'll meet with her and she'll be amazing.
Right.
And just so empathetic. And like, even though she's like, look, you're doing all these things. And, I know, she'll try to like kind of I don't want to say pacify me, but she'll try to like point out the positives, but she'll never disenfranchise me. She'll say, and you're feeling these ways. And of course you're feeling these ways. That doesn't take away from all of that. So I just want to put out there, if anybody in the medical field is watching this, I just want to let you know, we don't think all of you suck. There are some that have really impacted us in very negative ways. And we're very lucky when there's people that have more awareness.
Yeah, absolutely. Well, and I do want to say, it's not that I never had moments where I broke down or was upset or was scared or, of course I had those moments. Most of those showed up with my husband, and he has experienced, his brother died young from medical stuff. And so he has understanding of experience within the medical system and the scariness and the unknowns and all of that. And so I think he was a big container for me. So I didn't really show up in the office or with my providers because it would show up at home where I would just
support.
Yeah. And he didn't necessarily understand what I was upset about or the medical jargon or whatever, but he would just reassure me, like, we're going to figure it out together. Like, well, what if I can't walk and I have to use a wheelchair? He's like, then we have a ramp in the house. Like, he would come up with like, this is the response to that. And so it was like, okay, but isn't that gonna be annoying for you? He's like, why? I can walk up a ramp. Like, like, it's like, why would, so I think his level of empathy was so helpful, and just, he never made me feel like I was crazy. He never made me feel like I was making it up. He was like, oh my God, stop complaining about it. He's like, yeah, this is scary. And like, even when I would say, I know I'm talking about this a lot and I'm sorry that I keep talking about it, he would say, listen, it can get annoying, but I can only imagine how annoying it is for you. If you have to talk about it that much, how much do you be thinking about it? And I'm just like, who are you as a human? Like, how do you
know? You're making me cry. That is amazing. Yeah.
So I think when I say, I didn't freak. I'm sorry, go ahead.
Just to have that level of social support, because if other people around you are frustrated, if they're if you can feel their frustration and how you might shut down and how scary, it adds a whole nother layer of scary, right?
It
And like,
does.
who do you go to? And then hopefully you find like, an MS support group, for example, where you find other people
Mhm.
who can be that way. Anyway, so, all right,
Yeah.
there you go, you get the medication. And is that what's been happening since?
So I get the medication and then I take it religiously because anxiety and medical adherence and be a good patient. And um, then 3 years later, I'm like, I got to quit my job. I can't work. I'm so tired. I can't function. And so I'm at my next neurology appointment. At this point, I'm in a different state. So I'm with a new neurologist, and he's like, oh, well, here's some medication you can take. It's actually for narcolepsy, but we use it off label for MS fatigue, and it's called modafinil. And you can take 200 milligrams of it. Well, but be careful because you could build up a tolerance. So this is where my anxiety kicked in, and I would take 100 milligrams every once in a while,
Is it
not every
addictive?
day. Huh?
Is it addictive? Is that
It's a
why?
stimulant. So you
It's a
build up a
stimulant.
tolerance to it.
Oh,
And
okay.
so like, so you'd say not take on the weekends, all this kind of stuff. And so
Sound
I'm
like
like,
an
okay,
person with ADHD.
right,
My
exactly.
husband was like, I'm going to take a break from my medication. And I'm like, I am going to,
Please don't. Yeah.
I'm going to have my own Dateline special. All right, go ahead.
And so I would take it sporadically. And then, I think so 2 weeks ago, I just started taking my full dose.
Did you? Okay, I don't want to laugh because it's not funny that
No,
you have
it's
to
funny.
take it,
It's
but
funny.
you're still.
It's
So
still,
how has this changed your life? You said it was life altering. How has it done that?
yeah, I know it doesn't sound like it because I'm like, oh, I've got it. Like I'm talking about it. So, and I think this is part of it, right? Like I talk about it so disconnected because I am very disconnected from it.
Mm,
I understand it logically. I get it. I do the things, but actually something I'm working on my own therapy right now is like connecting with my MS and understanding how that impacts me instead of just there a list of symptoms. It's like, yes, it's a list of symptoms and also it's impacting you on a physical and emotional level every day. One of the things that has come about from that is I've developed migraines and the MS population has a 5% higher rate of migraines than the typical population. But my migraines are atypical, so I don't actually get a headache with it. It took us 3 years, 3.5 years to identify what was happening. I went through an autonomic nervous system workup. I went through an oncology workup. I went through a cardiology workup. I mean, like you name it, we went through it. And so at the end of it, it was like, well, you're either having seizures, which is not what it sounds like,
mhm.
or migraines. Because what was happening is it was the same span at the night. I would have the same symptoms and it was triggered. We could pinpoint, like if I wanted to make it happen, I could have. I knew exactly what would make it happen. I would be too hot. I'd be stressed. I would eat something warm. I'd have my legs covered up. I mean, there were like all of these things, but my symptoms would show up as psychiatric. So
Oh,
I would get intrusive thoughts about suicide or about hurting somebody that I loved. I have
wow.
OCD, so it just interacted with my OCD in that way. I would feel panicky, sick to my stomach. I'd have to go to the bathroom. I mean, it was just like this awful experience. It was kind of like
You were
having
in
the
fight,
flu.
flight, freeze, fawn response.
Yeah.
Like
Uh,
that's all fight stuff, right?
yep.
Like
And
suicidal ideation's more of a flight, but
mhm.
homicidal, wanting to run, the panicky feeling. So it just threw you into complete panic mode.
Yeah, like my nervous system was completely like out of whack. And it was all intrusive
Wow.
thoughts, right? Like it was like these images. Normally, I think when I think I can hear my thoughts, right? Like I'm thinking in a voice,
Mhm.
but these would come in pictures. And so it was like very upsetting and
That's like
daunting.
PTSD. Like people say, oh, I have intrusive thoughts, or what are they? I have triggers.
Yeah,
There's a difference between triggers and memories.
right.
Memories come up. Triggers are, I'm sitting here doing this, and the next thing you know, I see something that happened out of the blue. That is an absolute intrusive memory, right? You could
Right.
be, whatever, and it's coming and doesn't feel like it's in your control at all. And then
Hmm.
it exacerbates already pre-existing things that might be going on. So
Right.
that makes it worse and it becomes a big loop.
Yeah, absolutely. And then, of course, in my situation, it wasn't anything that ever happened. It was just like I would see these things, right? And it would be awful. And so, and I couldn't.
Oh
The
my God,
first
I can't
time
even imagine.
The first time I really remember it being like, wow, this is not anxiety. Because at first I was like, well, maybe it is because like there's all this content and like I am getting the same type of symptoms, whatever. But I was at a soccer game and I was playing. No anxiety, nothing was happening. I was just playing and it happened. And it was at nighttime. And I threw up and I drove home, couldn't turn the radio on because I could not listen. Like literally the sensory input was making me nauseous. I had my sunglasses on. It was nighttime, but I couldn't. And I made it home. And so I go through this for like 3.5 years. And finally, I'm laughing because it's so ridiculous. Finally, I go through all this stuff and my doctor's like, okay, so what happens? So you always have to go to sleep. Like, right. So what happens? How do you feel when you wake up? And he had never asked me this question. And I said, well, what do you mean? Like when I wake up, I'm fine. And he puts his head down. He goes, oh, you have migraines. He's like, I cannot believe I never asked you that question before because the number one treatment for migraines is sleep. And so he said, we have really good results with naproxen sodium. And I'm like, he's like, Aleve.
What?
I've been suffering for 3.5 years and I could have been taking Aleve. I was so mad.
Were you so? I
was so mad.
I can't even.
I was like, what?
Oh, you did. Well, I never heard of a migraine like that.
Yeah.
So just on a side note, it's these off-label uses like bone pain comes with leukemia.
Okay.
It just does. Like you feel your skeleton, like you truly feel,
that sounds awful.
And it's on fire and it hurts so bad. Yeah. And you know what they give you for it? Claritin.
Oh, interesting.
Claritin. Huh. An antihistamine, so it's reducing inflammation in your body, but Claritin. Yeah. Not Aleve, or not Aleve, not morphine, which is really what I want. Like, just freaking give me drugs and painkillers. And they're like, right. We're going to give you Claritin. I'm like, and so yeah. Aleve.
So
oh my God.
I start verapamil, which is a calcium channel blocker. Right. Because I don't have pain, so I don't need a migraine medication. And so basically, if I feel something coming on, what I would do is I would take Pepto-Bismol tablets. Like I would chew Pepto because my stomach hurt so bad when it would happen. And so my doctor said, okay, what I want you to try is if you have breakthrough migraines with this medication, when you were going to take Pepto, you can take it, but also take Aleve and see what happens. And I shit you not, pardon my language, I took the stupid little pill and within 30 minutes, I was fine.
That is unbelievable.
I was like,
wow, what an amazing pick. Pissed about the fact that it hadn't gotten figured out, pissed at yourself. Like, what were you pissed about?
I was pissed it hadn't been mentioned. Like in my mind, I'm like, there's no harm in taking Aleve. So if we don't know what's going on and you think it's migraine or seizure, why not just tell me to experiment and take a freaking Aleve? Like it was just, it was one of those moments where it's like, and at the same time, I do understand not because if it's a heart thing, I get it, but there's also the emotional part of me that just, I would say with my MS, I wasn't surprised and I kind of knew how to prepare myself. With my migraines, not the case. I was very surprised. I had no idea what was happening. A lot more fear with it, a lot more hopelessness, a lot more. It's always going to be because I can't do anything at night. I mean, my husband and I couldn't go out because if we went out to dinner and it was loud and bright, I would get a migraine.
Oh my God.
And so
and the emotional component for somebody who likes to intellectualize. Oh, hang on a second. Close that. Hopefully it's once in a while. It's not enough. It sounds like psychologists, we're famous for intellectualizing everything.
Yeah, we're really good at it.
And little do we know, like underneath, we're like completely disconnected. Because there's one thing understanding it in our minds. Mm-hmm. It's another thing to accept the reality of it in our heart. And that's part of the grieving process, is understanding that grief, part of integrating a loss is being able to accept the reality of the loss intellectually and emotionally.
Mm-hmm.
Both ways.
And it was interesting because with MS, I never wanted to have kids. That was never a goal of mine in life. But with MS, it's very hard to have kids because of the medications. You have to plan it and like all this stuff. And I remember them telling me the process. Well, if you ever want to have kids, you'd have to do this, this, and this. And we leave the appointment and Dave's like, you okay? And I'm like, yeah, but like, we really can't have kids now. He's like, well, we weren't going to have kids. And I'm like, yeah, but now it's not my choice. And like, that felt really upsetting to me. Like, even if I wanted to, I couldn't. It's kind of like, I want to be invited to the party that I don't want to go to. I want to say no.
It's control.
Yeah.
I want to have a control over something that's like, it's an either or. It's not a maybe.
Right.
Like, you're either pregnant or you're not pregnant. You either have, don't get me wrong, I know you can get children and have
Yes.
children in other ways, but I mean, you carrying a child in your body, it's either a yes or a no.
Right.
And this is a definitive no that you did not have the ability to make the decision about at that point, even though you kind of decided socially, psychosocially, you weren't going to have it.
Right.
So here is the loss of this potential future. Even if you weren't looking at that potential future, there's grieving that came with now knowing you weren't going to be able to because of the chronic aspect of your illness as well. I mean, if you did, it would have been extremely difficult and no promises.
And with like low motivation to have kids anyway, there's no way I was going to jump through all those hoops. Right.
Yeah.
So, I would say MS dictated my career path as well, because I left the city after I was done. I wanted to maybe do rehab medicine and potentially be in a hospital. And after that, I was like, no, I can't, not with the stress. Wow. So that's how I got into private practice and went a different direction. It's working out, but.
So how did this ultimately, if you look at it from a big perspective, how did this alter your life?
It actually made me more aggressive in doing the things that I want to do, if I'm honest. It's really been a catalyst to, most people say like, you shouldn't wait until to do whatever. And most people are like, yeah, I have time. Like, I really was like, I don't know if I have time. I don't know if I have time to climb mountains and hike with my husband and go whitewater rafting. I don't know. It's likely that I will have time, but we don't know how much time. And so we're really intentional about taking a trip and doing things like that. It's really at the forefront in that way. It's also really dictated how willing I am to receive help, because I have to in a lot of ways. So even though you can't see what's going on, I sometimes have to call my husband multiple times to say, hey, this is what I want to do. Is this the order I should do it in? Because I can't think about that. The planning part is too hard. And so just working on that self-acceptance, but honestly, it's like made me really sad in a lot of ways, just because there are things that I think I would have loved to do physically that I don't have the mental strength to do now, because I have to fight my physical, and I'm so tired a lot of the time that it's just like, I'm just not going to do those things. And so again, I think it just makes the future a little bit more narrow. But I do think it makes it more fulfilling, because it is narrower, and I'm not, just willy-nilly with my energy. I have to be really intentional about it. So
in a way, one of the benefits that have come from your experience of this has been valuing life and maybe relationships and what you do, your time currency, so to speak. It has given you a better appreciation for those things, even though you may experience times of, overwhelm, or I don't want to put words in your mouth, but whatever you and your therapist are working on, trying to get you to feel.
Yeah, overwhelm's a great word.
Oh, yeah.
And sometimes hopelessness, this is never going to end. It's always going to be like this, or even worse, Yeah.
Like how is this going to get worse? That's another concern of it.
And it's an unknown, right? So it's always going to be going on.
Yep. It's kind of looming.
Yeah.
And I know there's different kinds. I've known 2 other people with MS, and one, her story is heart-wrenching. Before that medication you were just talking about, and I watched what happened to her functioning and because MS looks different in everybody, right?
Yeah, everybody's course is different.
Everybody's one, yeah. And then another person that I know, she started with the tingling in her hands too. That was another one that happened. So, well, it sounds like you're still working through the emotional component of this, the
I
psychological.
don't think I've remotely started grieving.
Yeah. You think
Not
that
at
you're
all.
so you're kind of inhibited or delayed in it?
Mm-hmm.
Both? You're just like, yep, all the
All the
things.
things, yeah.
So inhibit. So now that you are getting more exposed to grief because you were dumb enough to come to one of my certification programs, is it bringing more up for you now?
I think it's making me more aware. Actually, it's like bringing up a lot about my soccer career. It's kind of where it starts. And so
Mhm.
what I am working on in therapy is we have to start there. In order for me to grieve my MS, I got to grieve soccer first. And I have
Interesting.
so pushed that into like a corner of my soul where I don't want to touch it. That, we got to start there in order to understand because, I went from being an elite athlete to a normal person, which already feels like a loss of ability, even though it's not. It just feels like it. And then I actually lost ability.
Right. And
So
then you actually lost ability. Interesting.
yeah. So it's a process, but I think what's really cool about being in our field, at least, and having good support and having a disability these days, especially, is there's so many options and there's support and there's help and there's people like you doing podcasts like this where there's information. So, I don't want people to leave thinking like, oh, it's so hopeless. Like it is at times, it feels that way. It's okay. It feels that way. And there are things that can come out of experiences like this that are meaningful if we look for them.
And I agree, I couldn't agree with you more. And I will say, as someone with epilepsy and knowing people with epilepsy, um, the degree to which their chronic illness is debilitating obviously makes a massive difference. It's one thing if you're like me, who has, a seizure once a year, and I am reading about people who are having 6 and 7 and 8 seizures a day,
Yep.
and the hopelessness and the impact of that psychologically. So same thing, I'm sure, with MS, when you're seeing people who are going through these relapse remitting kind of places, or if it's, now it's not, now it's chronic,
Progressive, yeah.
progressive, and how scary that is. So um, I'm just hearing you say, I'm still wrapping my head around all this. And it's not only the
Yeah.
grief of what's going on here and the overwhelm of the chronic illness. It's also all of like major losses that are also related to my body functioning and how that's impacting how my brain is functioning. And it's like, wait a minute, we've gone completely off. We've
Right.
we've gone off the trail here, and now I've got to figure out how to acclimate and adjust to that. And what is
Yeah.
that going to look like, if you there's so many unknowns. But I'm hearing you say I try to live more now, but I'm
I
also
try
a
to.
little disconnected from my emotions. So there's,
Yeah.
yeah.
Yeah. I would say it's protective in some ways and in other ways it's not. And so what I'm really trying to imagine is, getting through the stuck point of acknowledging the loss and understanding that the loss isn't going to kill me.
Yeah.
And I think that that's the psychological block there is like if I acknowledge it and deal with it, what's going to happen to me, which logically I get doesn't make sense, but emotionally
Yeah.
it makes,
I gotcha.
makes sense.
Oh my God, I could keep going on with this. But I do just thank you for coming here and sharing your story. I mean, it's the first time I've heard your story as well. And of course, I only wish you everything, the best
Thank
in
you.
your treatment. And I'm glad I get to continue to work with you. I feel honored by that.
Yeah.
And, I want to thank everybody who's been watching and or listening. And just if you've got a chronic illness, or you've got even a life-threatening illness, or you've got another idea that you want covered or whatever, if you're watching this and you're on YouTube watching this, put it in the comment section below of any topic here or any feedback that you have for Samantha or me or whatever. Any thoughts that you have, if you're watching a little short on TikTok, put it right there. Let us know. Happy to dive back in it, and I'm happy to drag her back onto the podcast.
I'll come willingly, I promise.
All right, cool.
Thank
Okay,
you for
cool.
having me.
I know, I'm so thankful, and thank you for the vulnerability. That's a lot to take in, I'm sure, for you.
Yeah,
So,
thank you. I appreciate you having me.
oh my God, I loved it. All right, everybody. Well, thank you so much, and just remember, it's through challenge that we awaken the power to heal. So until next time, bye.
Thanks for listening to Phoenix Rising with Dr. Z. If this episode helped, subscribe and share it with someone who needs it. We'll see you next time.